Hello, my name is Haley. I'm going to be providing some discharge teaching for postpartum mothers and newborns. So for the moms, they want to make sure they keep adequate nutrition because this will help their body heal. They want to eat foods that are rich in fiber, which are bran, broccoli, cauliflower, and fruits, and those will help their keep their bowel movements regular. Also, they want to eat foods rich in calcium, which would include leafy greens, milk, and yogurt. And they want to drink plenty of water, and then juices, but not sugary juices, so that can help satisfy their thirst and maintain hydration. Also, they want to avoid soft drinks, coffee, tea, and then alcoholic beverages. They can gradually increase their activity as they get back into their normal routine, but they want to make sure that they're resting frequently. They don't want to lift, push, or pull anything for at least 2 to 6 weeks, or as instructed by their physician. And they want to make sure that they don't drive until they're cleared by their physician as well. For breast care, they want to make sure that they are wearing a well-fitted and supportive bra both day and night, so that this can help them be more comfortable as their body adjusts to the changes that have happened while they were pregnant. They can also wear breast pads until their breasts stop leaking, and this leakage could occur anywhere from several weeks to months, and ice packs can be applied between feedings to ease discomfort. If the mother is not breastfeeding, then she wants to make sure that she refrains from anything stimulating her nipples, and that she doesn't pump or permit the newborn to suckle to alleviate the engorgement. She can apply a cold compress in the form of a frozen towel or cold packs for 15 minutes at a time every hour as needed. But she wants to make sure that she doesn't apply the cold directly to her bare skin. Some tips for breastfeeding is that the baby should have a tight seal around the mom's areola, but not their nipple. If they're suckling incorrectly, then the mother can slide a finger in between the baby's lips and her breast to gently break the seal, and then reposition and try again. She should feed for as long as her baby wants. Normally this is between 10 to 30 minutes, and sometimes the newborn will want to nurse a lot of times within a 24-hour period, but it won't be for very long. But it is important, if you are breastfeeding, to feed as much as your baby wants. Some good signs to look for when breastfeeding are that your baby is swallowing without a clicking sound, and that you see their ears wiggling, but you want to make sure that you don't see dimples in their cheeks. Also, your baby should be calm. You and your baby should be calm whenever breastfeeding. You should feel a gentle tugging at the nipple, but no pain. And if there is pain, then the baby just needs to be repositioned. For hygiene, you want to make sure that you're cleaning yourself frequently, and also washing your hands frequently to prevent infection. You also want to make sure that you wipe from front to back and cleanse your perineal area with a peri bottle after you either urinate or have a bowel movement. And you should also change your pad frequently. For bleeding, this will decrease in amount, and it'll go from bright red to pink to brown to yellow, then to like a cream color. And your menstrual period could occur as early as 6 weeks to 2 months after you give birth. For bowel movements, you want to make sure that you avoid being constipated, so you should take a mild laxative or a stool softener until bowel movements become regulated again. You could also increase the fluid and fiber in your diet. If you decide to take birth control, you should do this before resuming sexual intercourse, but with the options that your healthcare provider gives you, whichever one is best for you. For sexual activity, nothing should go in the vagina for at least 6 weeks after discharge, and sexual intercourse should be avoided until the bleeding has stopped as well, and until the female feels physically and emotionally ready. There are a couple signs that you want to look out for and contact your healthcare provider for. If you see these, they are pain, redness, warmth, swelling, drainage, or foul-smelling discharge from incision if you had a laceration or a C-section, discharge from vagina that has a bad odor, severe headache, blurred vision or visual changes, temperature over 104, thoughts of harming yourself or your baby, pain or burning sensation, redness, warmth, or swelling in your legs, breasts that are painful, swollen, hot, tight, itchy, or have sore spots or red streaks, sharp pains in your abdomen, breast, or chest, trouble breathing, dizziness, faintness, crying spells, or mood swings that where you feel out of control. And if you're unable to empty your bladder, and if urination is painful, difficult, or too frequent, and also if you're having difficulty with having bowel movement. And if you are experiencing domestic violence or abuse, you can call 1-800-96-ABUSE. Next, for your infant safety, you want to make sure that they're sleeping on their back and that there are no soft blankets, toys, anything like that in the crib around them. You want to make sure that they're sleeping in a sleep clothing, but with no blanket. You want to make sure that they're not routinely sleeping in car seats, and also you don't want to have any wedges or positioners in the bed with them. The baby should be in the same room as you, but not in the same bed as you. You want to keep a bulb syringe close by so that you can clear the baby's throat or nose when necessary, and you just want to make sure that you clean that regularly with warm soapy water and allow it to air dry. For hand washing, you want to make sure that you wash your hands before handling your neonate, and neonates are required to be in a car seat while cars are moving. At home, you want to make sure that you don't have any announcements saying that your baby is there, because this can draw unwanted attention from unwanted people. Also, you want to make sure that you don't use any home monitors or commercial lights marketing for reduced risk of SIDS. For behavior for your baby, crying is normal, and they could be crying for many different reasons. For example, if they're hungry, need a diaper change, or need to be burped, and you should burp them after each feed. Some ways to calm your baby could be by feeding them, changing their diaper, gently rubbing their back or their tummy, walking them, rocking them, doing skin to skin, or giving them a pacifier. But you should never shake your baby. If you ever feel angry or frustrated, then put your baby down in a safe place, take a break, and call somebody. And for their sleeping patterns, babies will sleep a lot, but you want to make sure that you're waking them up at least every 3 to 4 hours to feed. And that they should also have supervised tummy time to be able to strengthen their neck and their abdomen. For breastfeeding, you want to make sure that you're doing this at least 8 to 10 times per day per the infant's cues, and you want to make sure that they're close to you whenever you're breastfeeding. And then afterwards, you want to make sure that you burp them. You can hold them upright over your shoulder and gently tap their back. For newborn characteristics, there are a couple things that are normal. They might have a rash, they may have milia, and they may have jaundice. So the rash will be like small red circular areas with a white dot in the middle. This will resolve itself over time. You don't have to get it treated. The same thing goes with the milia. They're like little white bumps that can appear like on the face, mostly around the nose and maybe on the forehead. These will go away within like a week. It is also normal for babies to be jaundiced, so it might start at their head and then slowly move down their body. And this is normal, but it's not normal once they get more yellow after 24 hours. That at that point, then you would want to contact your healthcare provider. You want to make sure that you're bathing your baby. Just sponge bath them until the umbilical cord falls off with a soft washcloth and plain water. You can also use a mild infant soap. And for their cord, their umbilical cord, you want to make sure that it's kept clean and dry, and that you cleanse it with warm soap and water if it gets soiled. And then you want to make sure that you inspect for drainage and contact the healthcare provider if you do. For their diapers, it's normal to have 1 to 2 wet diapers for the first day or 2 of life, and then after that you should expect at least 6 to 8 wet diapers with pale urine every day. Over the next few days, your infant's bowel movements will begin to change, and they should have at least 1 bowel movement every 24 hours. For their genitalia, for example, if you're having a female, then you want to make sure that, as for yourself, you wipe them from front to back, and you cleanse all creases and folds to prevent diaper rash. Pat them dry, and it is normal for girls to have a white or pinkish discharge. And then for dressing your baby, you want to dress them as you would yourself, but don't overdress them because they can overheat very easily. And then it is recommended for infants to have vaccines.